desk is doing their job, because as doctors, we always just assume that it's being done, and but it might not be, but I totally agree. Let's say you're actually talking to the doctors now. What are some of those things, maybe either that we're billing incorrectly, or things maybe that we could be billing for that we're not billing for? Talking about just normal in-office visits or procedure types of things.
Yeah, so doctors, the portion of the doctor, doctors also need to understand a little of the guidelines. What I like to highlight to my doctors is, you need to understand what is the top. Usually doctors have one or two, maybe three carriers that are the main revenue maker for their practice. Mm-hmm. It's very important to identify who are those carriers that bring the revenue, the bulk of your revenue. And then understand what is your top 10 procedures that bring revenue for your practice. Once you understand that, then you need to learn what do you need for reimbursement of those top 10, and then understanding, navigating through these guidelines, it's crucial for revenue. So we see doctors, because of this lack of understand, the notes does not support the coding. So then when insurance requests for notes, supportive notes, or if the doctor is being audited, so that's not sustain these coded bills, and also understand when to bill, mainly when we're doing orthotics. So I believe 80% of the doctors, they bill incorrectly for orthotics. Usually orthotics are billed when they're casted. The doctor usually bills for those orthotics, which is incorrect. In healthcare, you cannot bill pre-bill. You need to only bill when you provide.
Dispense them, yeah.
You didn't dispense, so you cannot bill for it. So you can bill for casting, which many doctors also miss billing for casting, So it's understand also what's on your package of service, why you can bill for it, Mm-hmm. And then have these protocols into the practice, so things are not missed to bill and not billing correctly.
Yeah.